Hey y'all, welcome back to my channel. I'm Muriel. This is Nurse Muriel. And I had a subscriber request to do a video about rehab versus long-term care. Let me start by saying, hey y'all, yes, this is my second upload today. I'm proud of myself, y'all, but I wanted to get this out before I forget. So the subscriber states that she works Monday and Friday, I believe, on a rehab unit in a long-term care facility, and it's a lot of work. She wanted me to do a video about the difference between rehab versus long-term care. As some of us may know, when patients are discharged from the hospital, sometimes they go to a post-acute rehab facility. A lot of long-term care facilities have post-acute rehab floors. These floors, the patients typically, like I said, they come from the hospital. So they're kind of used to a certain level of care, which I will say, from someone who worked in the hospital, we basically waited hand and foot on the patients. We were one nurse to 6 to 7 patients. So we had a little bit, I'm going to say a little bit more time to dedicate to the whims and needs, every little whim and need of the patient. And let me tell you, when I say every little bit, I mean a patient could be vomiting in the next room, and if your patient next door asks for an applesauce, we would get we would have to run to get that applesauce. Like, there is so much demand for customer service in the hospital that we are basically like waiting hand and foot on the patients. And I feel like when they come to the rehab unit, the patients don't take into account that they are not one of 6. They may be one of 20. One thing I could say about rehab patients is pain medication. They be on it. Like, they're so used to in the hospital getting those stronger pain medications, like, we administer morphine, Dilaudid, IV pain medication and stuff. And they are so used to getting that pain medication, say every 4 hours, every hour if they have a PCA pump, every 2 hours. And then when they come to long-term care, they are actually doing a lot of physical rehab that is really that's painful on the body. And so, when they come in for rehab, you already know pain medication on deck. If the pain medication is due every 4 hours, they're going to ring for it every 4 hours. They look for that 1 to 6 care that they get in the hospital on a 1 to 20 rehab unit. And I'm gonna let you know, it's not possible. It's not possible. Out of 20, you have 14 demanding patients. It's not easy to meet the demands of all those patients. On top of that, all the documentation that has to be done on rehab patients. You have to document every day. You have to basically really assess every day the patient, because coming out of the hospital, you have patients come from the hospital on Monday day, and by Monday night you're sending them back to the hospital. So it's a lot more assessment has to be done on a rehab unit. Now, mind you, a lot of those patients end up going home within like 30, 60, 100, 120 days. But some of them end up getting transferred to a long-term care unit because they're not able to meet the goals set by therapy, and they're deemed not able to care for themselves at home. So if they don't have anyone home to care for them, and they're not going to be able to even care for themselves with home health, they end up getting transferred to long-term care side. And long-term care side is a different beast, but it is less stressful than the rehab side. You have a lot of family members who are there all day, and they're just sitting there with their family members. So on top of catering to the needs to the resident, you're catering to the needs of the family. And it takes a lot of getting used to, but it's a lot to cater to the needs of a patient and to cater to their family. But when these patients first come in, sometimes with rehab, you have to get a routine about yourself. Like, if you know this patient wants their pain medicine every 4 hours and they can get it, go ahead and be prepared every 4 hours to give it to them. Assess their pain level. Ask them, assess like, if a patient is about to go to therapy, pre-medicate them for pain before they go to therapy. You can kind of set the tone for the rehab patients by finding out what their pain level is. Because I'm gonna tell you, it's a lot of rehab is pain management on that rehab floor. It's a lot of pain management, and you have patients who they still do watch the clock. There are I have met some patients who do not want that pain medication because they don't want to get addicted, but there are a lot of them who definitely want their pain medication, and they're used to getting it in the hospital. And so when they come to your floor, they want that pain medication on a schedule. You can kind of work out a schedule with the rehab patients. You can once they come in for admission, get to know the patient, you know, how they like things done. Like there's a questionnaire that is asked on patients when they come into the facility, like do they prefer their showers in the daytime or in the evening? Do they prefer to eat meals in the room or in the dining room? What time do they prefer to get up during the day? Like find out those things about the rehab patients and then act accordingly. Now, sometimes these things can change the longer they're there, but for an easy transition, find those things out first from your rehab patient. And if you can't find it out from the rehab patient, find out what the expectations are from the family members, because a lot of times, a lot of stress that happens on the rehab unit is not attributed to the patient, it's attributed to their family members. Like their family members are expecting you to cater to them as well as the patient. I have always had a problem with this. That's part of that holistic care. I have always had a problem with this. I cater to the needs of my patient, especially if they're alert and oriented. They're alert oriented, like I'm saying, have no cognitive defects or deficiencies. I like to cater to the patient. I don't like to cater to their family members, and I had to learn that I had to cater to the family members. Now, mind you, on rehab units, just know they come in there all ages. You can have a 30-something-year-old rehab patient, but you know they're not going to be a long-term care patient, and their mindset is different than your 70-year-old rehab patient. The 30-year-old will have more autonomy to themselves than, say, somebody's 75-year-old grandmother who broke her arm. But like I said, one of the main things on rehab is pain medication, documentation, and assessment. And this is the reason why I say 1 to 20. Really, 20 on a rehab unit is a lot for one nurse, to be honest, because there is a lot of documentation on a rehab units. You can get 2 to 3 admissions at one time, and that's because they're fresh to the facility. They're coming in with this insurance that's going to pay for all this therapy. So they put those patients on the same hall, which ends up being the rehab hall. You have PT/OT running amok through there, which sometimes it's a good thing because PT/OT will do baths for the patients and get them bathed and get them ready for the day. Your part is to give them their medicine, assess their pain level, pre-medicate them before they go to therapy if that's what they choose, because therapy can be very painful in the beginning until they actually get their muscles used to performing those activities, like, you know, they be on the bike and do all that in therapy. But no one really likes to work the rehab unit. Rehab unit is the closest thing I would say to med surge, except you're dealing with much more. You're dealing with a higher number of patients who should have a less acuity, should be at a less acuity level than the med surge patient, but you really have to be on top of them because their acuity level can change at the drop of a dime because they're so like freshly post-acute from a med-surg unit. I hope this helps. I would tell people at all costs, avoid the rehab unit for your sanity. Start on long-term care and work your way up. Rehab, their conditions are more acute, newly acute. Once they hit long-term, they're considered more chronic. And yeah, so that's my take on rehab versus long-term care. If you have anything you want to add to the discussion down below, any questions, I may not have hit on everything, just like I said, go down in the comment section, do what you do, and I'll try to follow up as soon as I can. Thank you. Have a good day.